Educational video to demonstrate preparation of autologous platelet concentrate enriched with growth factors, APC+. The authors of this material have taken care that the information and recommendations presented in this video are accurate. Nonetheless, it is difficult to ensure the accuracy of information for all circumstances. Please refer to the policies and procedures of your facility prior to implementation. Overview. Tissue injury is a natural consequence of any surgical procedure. The body's natural response to this injury is a series of events that include hemostasis, inflammation, regeneration, and remodeling steps, collectively referred to as the healing cascade. This healing cascade is initiated and controlled by bioactive proteins found in platelets, plasma, and white blood cells. It is now possible to draw a small amount of the patient's blood just prior to surgery to harvest and concentrate those proteins. This allows the surgeon to deliver these proteins to the surgical site to help stimulate and accelerate the healing process. In fact, recent studies have shown a dose response between increased protein concentration and greater cell proliferation. Increasing the concentration of these bioactive proteins acts as a catalyst for accelerating the normal wound healing process. The purpose of this educational video is to demonstrate the preparation of APC+ using the SmartPrep 2 platelet concentrate system. Introduction to equipment and accessories. The SmartPrep 2 platelet concentrate system consists of the microprocessor-controlled SmartPrep 2 centrifuge system, a convenient workstation, reusable counterbalance weights, and disposable APC+ procedure packs. APC+ procedure packs are available in 3 sizes: APC 20, APC 60, and APC 120. The procedure packs are designed to process whole blood volumes ranging from 20 milliliters for the APC 20 up to 120 milliliters for the APC 120. The 3 sizes offer clinically useful product volumes covering most surgical applications. The LK2 liquid applicator and the SK2 spray applicator make product delivery predictable, easy, and efficient. Introduction to SmartPrep procedure packs. The SmartPrep procedure packs are available in 3 all-inclusive disposable options based on the surgeon's needs. The APC 20 produces 3 milliliters of APC+ for small applications. The APC 60 produces 5 to 10 milliliters of APC+ for medium applications. The APC 120 produces 10 to 20 milliliters of APC+ for large applications. Each procedure pack consists of 2 components, a blood draw kit and a blood processing kit. The APC 20 blood draw kit contains one 19-gauge IV fistula, a 20 milliliter blood draw syringe assembly, a 3 milliliter anticoagulant syringe assembly, a vial of ACDA 30 milliliters anticoagulant USP, and a blunt plastic cannula. The APC 60 blood draw kit contains one 19-gauge IV fistula, a 60 milliliter blood draw syringe assembly, a 3 milliliter anticoagulant syringe assembly, a vial of ACDA 30 milliliters anticoagulant USP, and a blunt plastic cannula. The APC 120 blood draw kit contains one 19-gauge IV fistula, 2 60 milliliter blood draw syringe assemblies, a 5 milliliter anticoagulant syringe assembly, a vial of ACDA 30 milliliter anticoagulant USP, and a blunt plastic cannula. The APC 20 blood processing kit contains a 20 milliliter process disposable, a 30 milliliter plasma syringe with blunt cannula and 1 spacer, a 20 milliliter platelet concentrate syringe with blunt cannula, a spare 10 milliliter syringe with blunt cannula, and 3 color-coded sterile plastic cups. The APC 60 blood processing kit contains a 60 milliliter process disposable, a 30 milliliter plasma syringe with blunt cannula and 2 spacers, a 20 milliliter platelet concentrate syringe with blunt cannula, a spare 10 milliliter syringe with blunt cannula, and 3 color-coded sterile plastic cups. The APC-120 blood processing kit contains 2 60 milliliter process disposables, 2 30 milliliter plasma syringes with blunt cannulas and 2 spacers, 2 20 milliliter platelet concentrate syringes with blunt cannulas, a spare 10 milliliter syringe with blunt cannula, and 3 color-coded sterile plastic cups. Preparation for the blood draw. The patient's blood should be drawn prior to the start of the procedure and before administration of any IV fluids to maximize the amount of available platelets. The blood draw can be conducted in either the patient holding area or operating room. Separate the blood draw kit from the processing kit and remove the peel-off cover. Load the blood draw syringe with anticoagulant and cap the syringe. For the APC-20, draw 2 milliliters ACDA anticoagulant into the 20 milliliter blood draw syringe. For the APC-60, draw 6 milliliters ACDA anticoagulant into the 60 milliliter blood draw syringe. For the APC-120, draw 6 milliliters ACDA anticoagulant into each 60 milliliter blood draw syringe. Attach the patient identification label to the blood draw syringe. Preparation of the venipuncture site. The healthcare professional responsible for blood collection should be trained in the practice of phlebotomy and its inherent risks. Aseptic technique, proper skin preparation, and continued protection of the venipuncture site are essential. A suitably large peripheral vein free of lesions should be selected, usually in the antecubital fossa, typically the median cubital or cephalic vein. Apply a tourniquet or blood pressure cuff and identify the venipuncture site. Once the vein has been selected, prepare the site using 70% isopropyl alcohol, applying with friction in a circular motion, working from the intended site of the venipuncture outward. Allow the site to dry before inserting the needle. After the skin has been prepared, it must not be touched again. Do not repalpate the vein at the intended venipuncture site unless your finger has been prepped with alcohol. Use the 19-gauge fistula provided in the blood draw kit or an intravenous IV fistula access catheter to withdraw blood. A central venous line, preferably greater than or equal to 19-gauge, may also be used. Blood draw for platelet concentrate from an arterial line is not recommended. Arterial lines usually consist of small lumen tubing, which may result in platelet aggregation due to the shear forces of blood flow through the arterial tubing during the blood draw. Make sure that the tubing clamp is closed before performing the venipuncture and inspect the needle. Perform the venipuncture and anchor the needle just below the wings. Drawing the patient's blood. For this training video, we will demonstrate the use of the APC-20 procedure pack. Connect the blood draw syringe to the butterfly or IV access catheter. Release the clamp. Pull back slowly on the plunger about 1 milliliter per second until the desired amount of blood has been withdrawn. Fill the 20 milliliter syringe to the 3/4 ounce mark. Fill the 60 milliliter syringe to the 60 milliliter mark if using the APC-60 or APC-120 procedure pack. It is important when drawing blood not to pull back too hard on the plunger. Excessive or aggressive pulling on the plunger can create high vacuum pressure and may result in damaged or activated cells, or can cause the vein to collapse, limiting blood withdrawal. When the desired volume of blood has been withdrawn, clamp the tubing and disconnect the syringe. Pull back approximately 1 milliliter of air for mixing and cap the syringe with a blunt needle. Gently invert the syringe several times to ensure adequate mixing of the blood and anticoagulant. Release the tourniquet. Remove the IV access device. Dispose of contaminated material and sharps in a designated biohazard container. Loading the process disposable. Open the process kit. Immediately transfer the wrapped sterile cups to the surgical field. Begin by loading the anticoagulant syringe assembly with ACDA. Draw 1 milliliter of ACDA into the 3 milliliter anticoagulant syringe assembly for the 20 milliliter process disposable. Draw 2 milliliters of ACDA into the 10 milliliter anticoagulant syringe assembly for each 60 milliliter process disposable when using either the APC 60 or APC 120 procedure pack. Transfer the ACDA into the plasma chamber of the process disposable designated by the white port. To load the blood, transfer the total blood draw syringe volume into the blood chamber of the process disposable designated by the red port. Loading the centrifuge. Place the filled process disposable into the SmartPrep 2 system. Insert the appropriate reusable balance weight as needed. The red balance weight is for use with a 20 milliliter process disposable. The blue balance weight is for use with a 60 milliliter process disposable. If using the APC 120 kit, the second process disposable functions as the counterbalance. Failure to use the balance weight will result in an imbalance and the centrifuge will automatically shut down. Processing the blood. Ensure that the process disposable and balance weight are completely seated into the rotor trunnion. Close the lid. Press the green Start button located on the front panel of the SmartPrep 2 system. The SmartPrep uses an automated dual spin and decanting process coupled with a self-calibrating floating shelf technology to automatically optimize platelet recovery. During processing, the red blood cells begin to pack underneath the floating shelf. The floating shelf rises to just below the buffy coat red blood cell interface. The centrifuge then slows, allowing the platelets, white blood cells, and plasma to automatically decant into the plasma chamber. The centrifuge accelerates to form a pellet of platelet concentrate in the bottom of the plasma chamber. The entire process separates the whole blood into 3 components: red blood cells, platelet poor plasma, or PPP, and autologous platelet concentrate enriched with growth factors, or APC+. The process is completely automatic and takes approximately 14 minutes. The timer on the front of the SmartPrep 2 system will show the remaining processing time. An audible alarm will sound once the cycle has been completed, indicating that it is now safe to open the lid and remove the process disposable. Removing platelet poor plasma. As soon as the process cycle has completed, press the white lid button located on the front panel of the SmartPrep 2 system. Remove the process disposable. The blood chamber of the process disposable contains the red blood cells. The second chamber contains the platelet concentrate, a button-like precipitate, and platelet poor plasma, supernatant. Avoid tilting, dropping, or shaking the process disposable, as this can prematurely mix the fractionated components. If the components are inadvertently mixed, place the disposable in the SmartPrep 2 system and reprocess. Place the process disposable in the disposable holder located on the SmartPrep workstation. The plasma volume used for platelet resuspension when using the APC 20 procedure pack is 3 milliliters. Using aseptic technique, Insert the plasma syringe with a white spacer guide into the white port of the plasma chamber. Push the cannula down until the white spacer guide is firmly seated against the white port. Withdraw the platelet-poor plasma volume from the plasma chamber until air enters the syringe. Approximately 3 milliliters of PPP and platelet concentrate will be left in the process disposable. Resuspending the platelets to make APC+. The platelet concentrate is then resuspended in the remaining platelet-poor plasma, thereby creating a very concentrated autologous platelet concentrate enriched with growth factors, or APC+. Resuspend the platelets by withdrawing the remaining platelet-poor plasma into the platelet concentrate syringe without the spacer and gently injecting the platelet-poor plasma back into the plasma chamber. Repeat this process 2 to 3 times until the platelets have been visibly resuspended in the plasma. Observe the base of the plasma chamber to confirm that all the platelets have been resuspended, and withdraw the APC+ into the syringe. Using proper OR protocol, transfer the recovered APC+ into the red cup located on the surgical field. Avoid excessive force when transferring the APC+. Preparing the thrombin calcium chloride activator. Thrombin activates platelets to release growth factors and to set up the clot matrix. The activator for the APC+ is a mixture of thrombin and 10% calcium chloride. The typical ratio of thrombin to 10% calcium chloride is 1,000 units thrombin per 1 milliliter of 10% calcium chloride. To prepare the activator, remove only the vial of thrombin from the box and discard the remaining materials. Withdraw the appropriate amount of 10% calcium chloride into the extra syringe located in the process disposable kit. Inject the 10% calcium chloride into the vial containing the powdered thrombin. Invert the vial several times to ensure thorough mixing of the contents. Using proper OR protocol, withdraw the activator from the vial and transfer it to the clear cup located on the surgical field. Introduction of the SmartJet applicator kits. The SmartJet applicator system eliminates the guesswork when applying platelet concentrate, making product delivery both predictable and easy. 2 applicator kits are available for use with a SmartPrep system. The LK2 liquid applicator kit, which is used primarily for precision delivery of bioactive proteins to the wound site, and the SK2 spray applicator kit, which is used to apply a fine bioactive coating to the wound site. Each applicator kit consists of a 10 milliliter syringe, a 1 milliliter syringe, an applicator tip, either liquid or spray, a handle, and a stabilizer clip. Assembling the SmartJet applicator system. The SmartJet applicator system is assembled in the surgical field by the scrub assistant. Introduce the contents of the appropriate SmartJet applicator kit onto the surgical field. Lay out the components on the surgical field. Note the stabilizer clip is located within the handle. Avoid aiming the applicator components at the surgical field and personnel during the assembly process. Draw up the APC+ from the red cup into the 10 milliliter syringe. Remove any excess air from the syringe. The ratio of the APC+ to the thrombin calcium chloride activator is 10:1. Attach the filled APC+ syringe to the applicator tip and rotate the syringe in a clockwise direction. Draw up a proportionate amount of the thrombin calcium chloride activator from the clear cup into the 1 milliliter syringe in order to achieve the 10:1 ratio. Remove any excess air from the syringe. Attach the filled activator syringe to the applicator tip and rotate the syringe in a clockwise direction. Ensure that both syringes are firmly attached to the applicator tip. Attach the stabilizer to the plungers on the back of both syringes. Hold the plunger shaft of the 10 milliliter syringe and slide the plunger flange into the large slot of the stabilizer clip. Then swing the plunger flange of the 1 milliliter syringe over the top of the stabilizer clip, sliding the flange into the small slot of the stabilizer clip. Snap the handle onto the barrel of the 10 milliliter syringe and slide the handle back against the barrel flange. The final assembly should resemble a pistol. The SmartJet applicator is now ready to use. To avoid clogging of the tip during use, wipe the applicator tip with a sterile gauze immediately after each use. Place the applicator tip in a bowl of saline between uses. Wipe the tip again prior to use.